Living Clean, Living Well is a presentation of the Canadian Centre for Abuse Awareness and is brought to you by Freedom from Addiction.
Welcome to the show, everyone. If you are dealing with chronic pain, if you are finding that your pain medication is becoming too much, if you've been on opiates for years and years and years, and as one of our friends here and addiction counselors, Dr. Dawn Slesser, is fond of saying, you're sick and tired of feeling sick and tired? Well, this show is for you. Welcome to Living Clean, Living Well, everyone. And tonight our guest from Freedom from Addiction, Dr. Kumar Gupta, who is the medical team leader. Welcome, Dr. Gupta.
Thanks, Teresa.
And Daniel Kahn is returning to the show. Daniel, great to see you.
Hi again.
Addictions counselor. Daniel is also working with Freedom from Addiction. So, gentlemen, we've been meaning to do this show for a while, and thank you so much for coming in to talk about it. We've been listening to you. You folks have called in so many times and let us know through various other ways, email and on Facebook, that pain management is really something that you would like to talk about, that you want to know about. But as always, we're always here for your general questions and inquiries. If you're struggling, if you need help, you don't have to be on topic. All you have to be is sincere. Give us a phone call and we would love to talk to you. Tonight our topic is pain management, prescription problems with people, trying to get off opiates and things like that. And Dr. Gupta has been doing some amazing work at Freedom from Addiction. And we'd like to talk to him about it, and Daniel as well in the counseling end. So Dr. Gupta, tell us a little bit about your work and how you got into addictions. Let's start off there.
Well, when I went through medical school, I didn't realize that addiction would be my field. I never even thought that would be close to what I was doing. But I think I got interested in it because I saw how so many people got better, and how devastating the disease actually is, and how many lives it actually affects. So I slowly got more interested in it, and then I did my training in addiction almost over a decade ago, and my focus has been addiction, helping people recover from prescription opioid addiction or alcoholism, and be what it is. We have every sort of addiction at Freedom from Addiction, so. Yeah. But prescription opiates is a big one.
Big one, absolutely.
Big one.
I want to get into the details of what the services are that you provide at Freedom from Addiction, because they've had a really good success rate. And I know there's a lot of people out there that are looking for answers. Before we go there, Daniel, I'd love if you could just share a little bit of your story, how you got into the area of addictions counseling.
I'm in my own recovery as well. So that's what brought me to this sector. And I found that what I was doing in previous life just wasn't satisfying anymore, and I really wanted to support and help others, and went back to school, got my addictions counseling education, did some trauma education as well. I'm kind of biased towards trauma work, and loving what I do now, so I'm very happy to be helping others and helping myself at the same time.
Awesome.
Yeah.
I'm curious as to why there is such a big prescription drug problem. Dr. Gupta, what are your thoughts on that?
I think the problem lies in the fact that physicians aren't trained properly in treating pain. So when you go through medical school, you learn about the diseases, but there's not really a big emphasis on pain management. So I think what happens is when you're out there in the community and then you have a patient suddenly in a lot of pain, as physicians, we want to help people, right? We want to take away the pain.
Yeah, you don't want to see anybody in pain.
We don't want to see anyone in pain. But the problem is that we're not trained in how to stop the pain medication, or often we're not really aware of how addictive these pain medications are. So it's kind of a touch too, where the patient is needing pain medications and then the physician is struggling to sort of figure out how much does he need and when should I stop. And then it becomes a little bit more complicated. So what happens is the patient now becomes physically dependent on the painkillers. The physician kind of feels stuck, and it's a lot easier sometimes for the doctor to maintain them on the pain medication than to say, you know what, we need to start getting off them, we need to start tapering off them. We're not trained in that. And I think that unless you're an addiction specialist, you have special training in pain medication, most physicians out there are just, we're there to help people.
Yeah.
And the problem is that we end up being the enabler. Physicians, God bless us as a profession, but we can be sometimes, unfortunately, the worst drug dealers. because we are prescribing prescription medications. It goes to the community. It becomes a huge problem, and we don't know when to stop. And in fact, the biggest drug addiction problem in Ontario right now, we have an epidemic of Oxycontin addiction. We have an epidemic of fentanyl addiction. So, and it's coming from doctors. And it's not because doctors are trying to, deal with this, it's because we don't know when to stop. And patients are very good, if you're an addict, at getting the medications. So suddenly they're losing their fentanyl, they're losing their Oxycontin. People don't lose their Ventolin puffers, people don't lose their aspirin, but somehow everyone's losing their Oxycontin, we're replacing it, and we're sort of enabling that process, and then it becomes a huge problem.
Daniel, I find a lot of people that call in, they're scared of the withdrawal. What are your thoughts?
That's such a key part, and that's why we're lucky and fortunate to work from a medical perspective, a counseling perspective, an emotional perspective, all at the same time. Because it's really about, like you're saying, the person's being prescribed this for pain, and then they're on it, and they're maybe abusing it, and then as they start to taper off or come off it, either on their own or with a doctor, the pain is coming back.
Yeah.
These other pains are now starting to show up, and they don't know what to do with that. So if we can create an environment where a person is going through a change process in a more comfortable way, then the likelihood for them to continue to come off or go through some of the changes and gaining the ability to get to some of their goals, that's really what we're trying to accomplish from a different perspective.
Yeah.
So we're very lucky to have someone like yourself on our team to kind of look at it from a medical perspective with everything else that we're trying to do.
I had a chance to go into Freedom from Addiction and take a tour, a marvelous facility. It was just great. And you and I sat down and we talked, and I understand that you have a specific protocol that you follow, and you've had good success, haven't you, Dr. Gupta?
Yeah, I mean,
what do you do?
Like Daniel said, so it's frightening. So when patients are addicted to opiates, it's a physical dependency. It's a brain disease. Your brain changes. So it becomes a physical phenomena, and it's a very, very uncomfortable feeling to get off opiates. So we have a nice little protocol where we detoxify comfortably, and we believe in comfortable detoxes where people don't have to be in a lot of pain to get off their medications. And what we actually find is the biggest fear of people getting help is a fear of their pain coming back. Because the biggest reason why people get addicted is pain. It starts the process of getting, they get on it innocently, and they then become dependent on it, and it becomes a rapid cycle into full-blown addiction. And they all have one thing in common, all the patients. They're all nice, they're wonderful people, they grew up in nice households with good morals. Nobody entered our facility planning to become an addict. And what happened was they unfortunately had a pain syndrome that led them to a doctor, that got them introduced to an opiate, and unfortunately, it's Oxycontin is typically what's prescribed, and it's what the doctor does not tell the patient is that it is as addictive as heroin. And after even a week of using it, your brain starts becoming you become physically dependent. Not an addict, but you become dependent, and even getting off it after a week becomes uncomfortable because there's a withdrawal phenomenon as well as a physical and then a psychological dependency.
Sure. You were mentioning how you detox comfortably.
Yes.
Are you doing that medically?
We are doing that medically with medications, and I won't get into the details of all the medications, but I would say, and Daniel, I think you've seen the clients that you're counseling, I think they're comfortable because if we're doing it and making them uncomfortable, they're not going to engage in counseling because the whole point is to detox them and then have them engage in counseling.
Because that can be a dangerous process in itself, right?
Absolutely.
If it's not done properly.
Absolutely.
Yeah. So you've actually at Freedom from Addiction, they have these wonderful rooms that's the actual medical center.
Yeah.
And there's nurses there.
There's 24 nurses.
And you're there as well.
Yeah.
Wonderful.
As a consultant.
Well, it's good that we've had this chance to discuss it. We're going to take our first break here on Living Clean, Living Well. But when we come back, as I expected, we've got a lot of phone calls. So, folks, it looks like this show is away to the races. We're going to get to those phone calls right after this break. But if you have a question tonight about addiction, about substance abuse, and specifically pain management, pain medication, opiate addiction, these gentlemen are here to talk to you. So our first break, we'll be back with your calls right after this.
It's scary to think that you're going to live the rest of your life without drugs and alcohol when it's all you've depended on. But there is hope. I knew I couldn't do it alone, and treatment allowed me the chance to ask for the help that I needed in order to believe that I could live a sober life. I got the help and support that I needed, and even now that I've left, I still have that support there.
Welcome back. Our guest tonight on Living Clean, Living Well, Dr. Kumar Gupta, who is the medical team leader at Freedom from Addiction, along with Daniel Kahn, who is an addictions counselor. Shall we go to the phone lines, gentlemen?
Let's do it.
Absolutely.
It's your turn, folks. Let's go to line 1. Kate's been hanging on patiently from Stony Creek. Hello there, Kate. Welcome to our show tonight. You're first up. Go ahead.
Hi there. How's everybody today?
We're good. How are you, hon?
Good, good. I'm more or less calling about pain clinic wait times more than anything. I myself was on a pain management clinic wait list, and then a year surpassed, and my doctor's nurse called and said, "Would you like us to renew that?" And you would just go back on the wait list. And I actually opted out of that. I have a upper back neck injury. And they've taken me off of all pain meds, including, like, I was only on Tylenol 3, but they took me off of that completely. My question is, what are people supposed to do during that wait frame? And I mean, so that I know a handful of people who were on a wait list for a pain clinic but couldn't get in, so they actually turned to a street drug or something to get them through. So it's just a wait thing more than anything, I found. So I know that they're turning to other things.
Do you have a family doctor at all?
Oh, my family doctor?
Yeah.
I have a family doctor, yes.
And have you talked to your family doctor about, I mean, the wait time's a problem. I mean, you know, sometimes it's 3 to 6 months, but you're talking about managing your pain while you're waiting? Right. Is that the frustration that, that's what I'm hearing, sort of?
That's what I was talking about. Yeah, I didn't turn to street drugs, but I know a handful of folks who turned to something while they were waiting. Because
you feel there's not enough accessibility to a pain doctor who can manage their pain properly.
Correct. I myself was on a wait list for 1 year, and very recently the nurse from my doctor's office called me and said, "It's been a year. We need to renew this. Do you want to do this? Because you'll just go right back on the wait list." And I thought, no.
Yeah.
Daniel, are you hearing the same complaint from people you meet with?
We hear it constantly in terms of accessibility through OHIP beds or through certain public aspects. There are options, obviously, if you want to pay for them from the private sector. But like you say, I think this is something that's common and unfortunate that's out there right now. A year is a tremendous amount of time to wait, obviously, with seemingly not really an answer as to when that might come available for you. So, it's I'm grateful that you didn't turn to street in terms of that. And a lot of people absolutely do that, and I'm sure you've seen that as well.
Absolutely.
Did you have a final thought?
Pardon me?
Did you have a final thought for
Well,
Kate?
I'm thinking that maybe just talk to your family doctor again. There are many different facilities, and maybe have him refer you to more than one.
Right.
And so, if there's a waiting list in one will be shorter, and then you might get luckier and get a faster time in. So maybe look at more than one facility in your area and have them look into that.
Kate, thank you so much for calling in tonight. Let's go now to line 4. Hilda's calling in from St. Thomas. Hi there, Hilda. It's your turn on the show. Welcome to Living Clean, Living Well. Go ahead.
My question is, first of all, I'll tell you what my problem is. I have fibromyalgia and osteoarthritis. I have been put on lorazepam and oxycodone for the pain. But I am to the point now when I take them, I might as well take a drink of water. What happens to a person when the body becomes used to the medication and it doesn't work anymore? Do I talk to my physician to up the medication, or do I go on Oxycontin or What is the settlement here for the human body in this dilemma?
Dr. Gupta.
Well, I mean, you're absolutely right. I mean, if you feel it's not doing anything, then you just have the problem of just being dependent on them. And my understanding is, and I'm not going to interfere with you and your doctor, but talk to your doctor. But tranquilizers are typically not used for pain. They're used for sleep. They're used for anxiety. So they're not the medications we would typically use for pain. So you may want to talk to your doctor about maybe taking you off them slowly. The key is slowly. You've been on them for a while. And then sort of adding something while he takes you off it to something that you think may work. I mean, there's great medications out there that help pain. There's the anti-epileptics, like the gabapentins, the Lyrica. There's trigger point injections. There's a whole bunch of things they could do. But tranquilizers tend to just make people, once you're dependent on it, people actually feel better when they get off tranquilizers. They have more energy, they have more concentration, they feel better. High dose of tranquilizers can make people depressed. Fibromyalgia and depression go hand in hand. So you may want to talk to your doctor about sort of getting you tapered off that and getting onto something else while you're tapering off it.
And Daniel, from a counselor's point of view, what would you have to say to Hilda?
Yeah, I think the thing here that I'm hearing is really the tolerance that's happened internally, and I'm not exactly sure why you're on that medication, but the tolerance obviously is kicked into a point where I'm taking this and nothing's happening, which is typical with somebody who's using or abusing or being prescribed any type of medication. So not knowing exactly why you're on that medication, I'd just be careful in terms of self-prescribing at this point, saying I'm going to take more just because I'm concerned that it's not working. So I would definitely encourage you to go talk to your doctor or find a new one.
Now we've got a lot of phone calls to get through, but I just want a quick comment from you, doctor, if I may. She's mentioning should I be on Oxycontin or Oxycodone? Your thoughts on that?
It really is an individual thing. I mean,
but that's an opiate.
It's an opiate, and we're not saying not to get on an opiate. That's not the message of the day. We're saying that you have to be careful. You have to be wary if you get an opiate for pain, and you should try other options first, because the problem with opiates is that you become dependent. And it's not a short-term solution for fibromyalgia. It's a long-term solution. And it really should be a solution of last resort. And it's still an option. So we're not here to say opiates are not helpful for some people.
Fair enough.
They are.
Okay. Well done. Thank you. Thank you, Hilda. Let's go now to line 2. Ron's been holding patiently from Hamilton this evening. Hi, Ron. You've got a question for Dr. Gupta and Daniel Kahn tonight?
Well, I'd like to, but I really have some information for you all and for the community at large.
Love to hear it. Ron, go ahead.
Last week I heard some of the guests say that normally it's you have to wait 5 or 6 days in a detox, and then then you're kind of not do whatever you got to do from there. However, I found out, and I know from my own personal experience with them, the Hamilton Men's Withdrawal Management Center has gotten new funding, and they not just have the detox part of it, they also have a transitional part for men after they detox. They can keep 7 men there until they reach treatment.
That's great.
Excellent.
Ron, say the name of the facility again, please.
It's the Hamilton Men's Detox, Hamilton Men's Withdrawal Management Center.
Yeah, I've heard of them. They're actually pretty good.
Yeah.
They're actually, they have a nice plan of action once you detox, right, Ron?
Awesome.
Yeah, they're run by St. Joseph's Hospital.
Yeah.
Ron, I've always said that this is a forum of sharing, and thank you very much. I bet you there's a lot of people out there tonight that are thanking you. Thanks for calling in. Let's go now to Ottawa. Line 3, Gord's calling in. Hi there, Gord. Go ahead. Have you got a question or a comment for us tonight?
I have a question and a comment. Actually, I had a surgery 2 weeks ago, Monday, and when I left, I was given a prescription for Dilaudid. And as soon as I saw the name, I said, oh, why do you have to do that? Because I'm very, very leery and always have been of prescription medicine / abuse drugs. Okay. So what I did was I've been taking them, but lowering the amount that I'm taking from the prescription, and I got myself off it altogether. But in addition to that, I must say, with pain management, what I did was I knew I would have to raise my tolerance for the pain. But the good news is it's a surgery, and it will be over.
Yeah.
So.
Dr. Gupta, just before we begin, can you tell people that may not know, including myself, Dilaudid? What is it?
Well, Dilaudid is a powerful opiate,
Okay.
and it's indicated post-operatively. And you know, if all our patients were like Gord, we wouldn't have any patients in our facility. You know, Gord has taken himself off the medications responsibly, the way you should, and tapered himself down, and should be wary. Should be wary because you know there is some long-term side effects to these medications. So, good for you, Gord.
Yeah, Daniel, your thoughts on what he had to say?
No, I think you're bang on. I think it's great that there are people out there that are aware of these types of problems, and always get concerned when I hear somebody kind of managing their own medication volumes. But in this case, it's worked out great for him, and he was aware and educated himself in terms of what was going on. So it's perfect.
Oh, thanks for sharing tonight, Gord. Let's go now to Jason. He's calling in tonight from Oshawa. Hi, Jason. You're on line 5 tonight. Thank you so much for calling in. Go ahead.
Hi there. How are you guys today?
Good, thanks.
I just want to touch base on the fear of the withdrawal. That's one of my major factors, I think, right now. I've had 5 surgeries and a fused arm ended in the end. And my main fear is the withdrawal and the sick. But I do want to get better.
Yeah.
But I know it takes time, and it's the fear factor of it with me.
Yeah.
Jason just nailed a point that is sort of the most powerful feature that drives addiction is fear. I mean, you become dependent on it, and you just don't want the pain to come back. Right, Jason? That's where I'm at. You're worried about getting off it. You don't want the pain to come back. You're worried about worsening pain. And you know, in our experience, actually, what happens when people are on opiates is you lose a sense of where your pain's at. So what happens is you're not sure if it's withdrawal. Are you using your prescriptions regular? Are you taking street drugs? Or are you taking a prescription like opiate?
Just a prescription opiate.
Are you using it properly? Do you find yourself, you know, kind of overusing occasionally and, you know, kind of waiting to see the doctor? And
afraid to use it early because I know if you take your medication early, you run out.
Right.
You could be stuck, and then you could be in a lot of.
And then you get very sick with withdrawal. So you know, the key is what we find when we detox people off opiates is that, like what I was saying, is people lose a sense of where the pain is. They're not sure if they're in withdrawal pain, which is, you know, a body ache and worsening back pain, or is it the pain that you had that brought you onto opiates? And so what we find is when we detox people off opiates, they actually find their pain to get better, not worse. It's actually it's a paradoxical event that takes place. They actually feel better. You feel more energy. They actually find that once the withdrawal aches and pains which we treat are better, that their pain is much different. And it's, you know, quite a miracle. I mean, you can't do it on your own. You got to do it in a kind of either a supervised setting or with a good conversation with the doctor about a slow taper. The key is slow and gradual, you know, so you don't feel uncomfortable and you know what's going on. And, you know, my feeling is that you need to talk to your doctor about tapering you off and getting to where,
yeah.
you know.
From a counselor's point of view, Daniel, when you've got somebody that's sitting on the other side of the couch from you and said, I'm just so scared about what I'm going to go through, what do you tell them?
You know, Jason, if I can, I don't know if you're still there or not, but I'm wondering if just talking about it is reducing the fear in itself.
It does, actually.
Right. So that's really what I want to encourage you to do, is have those conversations about what it is that you're feeling, which is this fear that you've talked about, and just talk it through. And as you've just suggested, talking about it even with us tonight or with people that you might know, family, friends, or whatever, can support you in terms of reducing some of that fear that you have in itself.
When I was in the offices of Freedom from Addiction, Dr. Gupta, you were saying that sometimes you will do the medical detox, and then they'll go through the program with Daniel and the other counselors there. But you're finding as they come off the opiates or the strong drugs, whatever they're on, that you're finding that the pain that they originally went on them for is gone. Is that what you were saying
That's
there?
what I'm saying. And I think the reason why it took them so long to get to our facility is the fear, what Jason was talking about, the fear of the pain coming back, the fear of them having to cope without any opiate. But it's amazing because, you know, pain usually over time, you know, unless you have debilitating chronic pain, can usually get better. And it's just opioid withdrawal is painful in itself. Right. And, you know, they just lose a sense. And doctors in community are not well trained at tapering off, you know, medications. You know, we have to do a better job in Ontario. untrained doctors.
When we hear pain, I've never
Yeah.
been through withdrawal. I just, as I always say, I'm just the television host here. But but for folks that may be wondering about withdrawal, where's the pain they're going to feel? You mentioned the back or something.
Yeah, I mean, if anyone's opiate dependent, and you can verify this, I mean, it's the worst type of pain you could ever feel. It's just like a large toothache all over your body, inside and out. And when people, it's just a horrible feeling. But what happens is they're actually thinking about the feelings. And Jason, correct me if I'm wrong, but you're thinking, I'm sure you've been out of your medications earlier, and I'm sure you've had that feeling of horribleness all over your body, where, oh my God, like I can't wait till I see my doctor, it's that feeling that drives getting that prescription again and being very fearful of getting off. But that's kind of a very false sense of what's happening. That's not real. That's just a withdrawal that's there. But if you slowly taper your medications, actually, a lot of the pain actually goes away. And then you realize
the pain of the withdrawal goes away.
The pain of the withdrawal will subside if you do it comfortably. And there's ways to do it comfortably.
Which you do, right?
Which we do.
Yeah.
We give medications. We detox them with other medications, and opiate withdrawal does not have to be uncomfortable. We have a way to do it comfortably, and that's what the problem is. Because when you see opiate withdrawal, you think of the TV set of the guy puking, hiding in the bathroom and rubbing his body all over. I mean, it's horrible. But like I'm telling Jason, he doesn't have to go through that.
Okay, fair enough. Jason, I hope that gives you some hope. Folks, we have got a long lineup of people trying to get on to talk to Dr. Gupta and also Daniel Kahn this evening. We're going to take another break, but when we come back, more of your phone calls, and we're going to get to you, I promise. And folks, if you've got a question tonight, time to get on the phone because, as I mentioned, we got lots of calls to get to. So a short break, we'll be right back.
I've been through multiple treatment centers with my addiction, fighting it for the last 10 years, 17 detoxes, 3 different treatment centers. But they put me into counseling and everything here after my detox, which was the smartest thing I could have ever done. I got the real demons out of me that I wasn't able to do over the last 10 years with